Okay, so for everyone who's joining us, go ahead and take a look at this question. We're just trying to remember a couple things about the urinary system. Specifically, we want to remember what the main roles of the kidney are. And I know we have a big long list. Don't need to give me the whole list here, but just try and jog your memories about what some of the big points are. And then we want to think about what we think the most important structure in the kidney is. I tried to give you lots of hints as we were meeting on Friday, right, about the main focus of our study of the kidney. So hopefully you'll be able to name what it is and a couple of its parts. So like the main functional unit of the kidney. I'll give you a second to jot down your notes, maybe do a little drawing if you can, before we go over this together and pick up where we left off. Okay. Great. Okay. So as we were talking about the kidney, last time we looked at a lot of roles that the urinary system as a whole plays. Some of the really important ones we want to focus on are at the top of this list. So specifically, I would say really the three most important functions of the kidney that we're going to talk about are right up here at the top, these first three. We're going to be regulating the ion concentration of the plasma, which is super important to maintaining homeostasis, maintaining a nice consistent environment for our cells so that they can do all their normal functions, right? We've seen that ion concentrations are important for nervous cell function. They're important for various transport mechanisms. Really important that we have the right ion concentrations. We're also regulating blood volume and blood pressure. Very important that we maintain a good, high enough blood pressure to deliver enough oxygen to our cells and take away CO2. So important that it doesn't get too high. High blood pressure we know is sort of a chronic problem, right? Not an immediate problem, but high blood pressure puts a lot of stress on the heart and stress on the walls of our blood vessels, which can lead to stiffening, clotting, lots of problems. And finally, we're going to talk about how it stabilizes blood pH. So remember that blood pH has to do with the presence of hydrogen and bicarbonate ions. We're going to see that the kidney plays a big role in this as well. Okay. So when we're thinking about the main functional unit of the kidney, thinking about something called the nephron. So that's what I've highlighted for you here. We've gone and looked at a slice through part of the cortex and medulla in one of these renal pyramids. Now we've looked at this more microscopic anatomy of the nephron. Okay, so the nephron is where most of our focus will be after today. So this is our nephron. We can trace some parts of the nephron. We're going to go through them in detail later today, although I don't know if we'll get through the whole thing by the end of today, but we can already see some of the parts. And I'm actually going to look at this nephron on the right, this juxtamedullary nephron. So we start with this structure called the renal corpuscle. and it contains something called the glomerulus, which is not labeled on here, but that would be here in the renal corpuscle. We then go into our proximal convoluted tubule. So here's that proximal convoluted tubule. One of its big roles is we're going to be reabsorbing water into the body. And then we're going to go down into the loop of Henle, which is also known as the nephron loop. You can see we have a descending limb going down. We have an ascending limb going up, and we can see that the ascending part has both a thick and a thin part. Then we enter our distal convoluted tubule. So distal means it's farther away, so our filtrate is moving through it later on. And then we are going to go into our collecting duct. So after the collecting duct, we would go out the renal papilla, which is at the bottom of our renal pyramid, this being our pyramid. We'd enter a minor calyx, then a major calyx, then we would go out the renal pelvis into the ureter and into the bladder. So today we're going to finish up with that ureter and bladder part, talk a little bit about the micturation reflex before we come back to the nephron and the functions of the kidney. Okay, so just a reminder of the slide we left off on, because I know we can all get kind of tired by the end of class. So when we left it off, we had mentioned this structure called the Juxtaglomerular Complex. So the Juxtaglomerular Complex was this kind of region of cells roughly here. I'm going to circle them. Right? So we have these specialized cells that are partially from our distal convoluted tubule and partially from our arterioles coming in, afferent arteriole, and most especially, oops, sorry, that's the efferent arteriole, this is the afferent arteriole. Right? So we have some specialized cells on these arterioles, and we have a sort of specialized section of cells kind of nestled in between. So this whole thing together is the juxtaglomerular complex. It contains these three cell types. So the macula densa cells are part of the tubule. The juxtaglomerular cells are also called granular cells. That's the term your textbook uses. Those are part of the arterioles. And then the mesangial cells are those cells kind of nestled in between. So this complex as a whole is partially going to be involved in regulating flow through the nephron, but it's also an endocrine structure. And we'll talk a lot about some of the endocrine function of the kidney. We've seen a little bit already. We talked about the role of erythropoietin in the development of red blood cells. What we're going to talk a lot about in this unit is actually this hormone renin. So renin is going to be part of a whole big system of hormones, actually. We're going to have kind of a cascade, the renin, angiotensin, aldosterone system, and we'll talk about it later on. The renin is going to be involved with regulating blood pressure, which is one of our really important roles of the kidneys. So we'll see that the kidney is involved in blood pressure regulation, both based on how much liquid it's flowing out, but also due to this endocrine function in the kidney. Okay. So that was our intro to the end of our intro to the kidneys. So we want to talk a little bit about the urinary structures that are not the kidney. Okay. So after we leave the kidney, we go through this structure called a ureter. So it's going to be long and skinny, a tube going from your kidneys, which are kind of in your mid-back, going all the way down into your pelvis to your bladder. So they're exiting the kidney, specifically at the little fold called the hilum. They're going to extend to the bladder, and they're going to enter the bladder on its posterior side. Okay, so we can see the ureters here are coming to the back. So here we are actually looking at the structure. Sorry, I got distracted. We'll get to this in a second. But they're entering at the back. Their openings are actually in this sort of triangular area called the trigone. So they form a triangle, one opening on one side, one opening on the other side, and then leading into eventually the urethra. Okay. So here we see the urethra. So this is a male. We're going through the prostate gland. So we'll take a look at the difference between the bladder in males and females in a second. So ureters are going to our bladder, specifically the trigone area, which is at the back. Okay. The ureters do, like everything else, have their own special histology. So they have a couple layers. They have an inner mucosa, so an inner part, basically lining the inside of the tube. They have a muscular layer as well. So it has both longitudinal and circular muscles. So we are able to therefore contract the ureter itself, although that's not whole. And then there's an outer layer and an outer fibrous capsule. This outer layer is called the adventitia. So that said, we do want to know about the urinary bladder in males versus females because it's important for some clinical stuff. So in males, we're going to see that the urinary bladder is between the rectum and the symphysis of the pubis, so that bone in front, right, where the two sides of the pelvis join. In females, we have an extra structure in the pelvis, right? We also have a uterus. So in females, we're going to see that the bladder is inferior to the uterus, anterior to the vagina, and we'll look at its position in these next two slides. So here we're looking at the structure of the bladder in a male. So I'm gonna pick a better color to circle this with. Okay, so here we see the urinary bladder. All right, so here's the bladder. Here's the ureter coming down from the kidney. So other structures we want to pay careful attention to, right? We said it's between the rectum, right? So this is where we'll be excreting feces, right, from our GI tract, the rectum. And then in front, we just have bone. We have our pubic symphysis. So this is a slice through bone. Another important structure we want to be really aware of when we're thinking about the bladder in males is that we're going to see that the bladder is directly on top of the prostate. So we'll see that diseases of the prostate, because the prostate is right below the urinary bladder, and because the urethra, which carries urine to the external side of the body, right, flows through the prostate, we're going to see that enlargement of the prostate or any constriction of the urethra here in the prostate in things like prostate cancer is going to have real impact on bladder function and on excretion of urine. So this can be a symptom of prostate issues, basically. So that's one of the things you will look out for regarding urine in male patients or any patients with a prostate. And in female patients or patients with a uterus, we also want to note the position that uterus relative to the bladder. Okay, so we see one of the same structures we saw in the male, right? We see the rectum. So rectum is still all the way at the back. You hopefully will get a chance to appreciate this in the lab. Maybe appreciate is a strong word here, but you should notice it. Okay. Our bladder, or jumping to the front, is still directly behind the pubic symphysis. All right, so pubic symphysis here. So that's our bone. The uterus is on top, technically, right? Superior to the structure, but really it's kind of in between, right? So here we see the uterus, And here we see the vaginal canal, right, running between the bladder and the rectum. So a couple things here, right? For example, during pregnancy, right, we know that pregnant women, right, often have to pee a lot, right? So part of that is the fact that during pregnancy, right, our uterus would expand, start to push all the organs. Really interesting, our abdominal organs as well, right? So pushing the organs. We'll see that uterus pushing down on the bladder, right? So we're increasing pressure in the bladder in a really real way. Yeah. So that's one thing we want to be aware of when we're thinking about the relative position of the uterus and the bladder. Now, also in clinic, right, you may hear or instruct patients, right, to come to certain appointments with either a full or empty bladder, right? So sometimes we're going to want to make sure that as we're doing imaging, right, we are really sure where the bladder is. So we may want to fill it up so that it's full of fluid. So it's really clear on scans what is bladder, what is uterus. Not that you wouldn't be able to tell anyway, but this can be really helpful and help us visualize things correctly. So that is where the bladder is, and hopefully you'll see all these positions in lab this week and next. Okay. So we have our urinary bladder. It's suspended by some folds of the peritoneum. So the peritoneum is basically the lining of this region of the body, right? So it's going to have part of it on the body wall, right, surrounding all these pelvic organs. It'll have folds in it that basically act as ligaments, maintaining the position of the bladder, holding it up, right? We don't want it to descend, drag down, and put pressure on some of the structures below it and around it. So we'll see that we have structures that we call ligaments, so some named ligaments, right? We have one in the middle. Here's the median umbilical ligament, or the urachus. So the median umbilical ligament, right? I can think of that as being kind of related to the belly button. We have lateral umbilical ligaments, lateral coming out to either side. So the bladder isn't, you know, sort of free floating in your pelvis, right? It's held in place. In terms of the histology, or really the inner structure of the bladder, we're going to have a couple layers, but the most important one is going to be the muscular layer. So your bladder is at least partially going to be under conscious control, and a lot of that is going to have to do with the external urethral sphincter, which we'll take a look at in a minute. But we also have this muscle that makes up the bladder, right? Really, we can see that the bladder is almost entirely muscle, right? So this muscle that makes up the bladder is called your detrusor muscle. You can put pressure on the detrusor muscle, right? You can contract your bladder. That's going to be part of how you urinate, right? Is putting pressure on the fluid inside here. At the exit of the bladder, at the entrance to the urethra, we have an internal urethral sphincter. So sphincter always refers to basically a round muscle that can cut off the flow of things through it. So our internal urethral sphincter is right here in the neck of the bladder. That's not a great color. How about some green? Okay, so internal urethral sphincter. Now I'm emphasizing internal here because we're going to see a difference between the internal urethral sphincter and the external urethral sphincter. The internal urethral sphincter is under involuntary control, actually. So the internal sphincter is not the one that's stopping you from peeing. That's going to be your external urethral sphincter. So this internal one is going to open and close according to pressures basically in the bladder and in the body itself. Okay. The external urethral sphincter is located farther down. So here we saw the internal one, right? Now the urethra continues to travel, in this case through the prostate gland. So it has farther to go than it would in a female, right? But the structure overall is the same, right? We cross an area. And we cross something called the urogenital diaphragm. So we will have another layer of muscle, basically kind of part of your pelvic floor, right? And that's where we're going to have our external urethral sphincter as part of this urogenital diaphragm, part of this pelvic floor muscle set. Okay, so this is the one that's under voluntary control. And this is the one, you know, that you can think and stop yourself from peeing if it's not convenient for you. And you learn to control it as an infant. And you do lose control as you age or due to spinal cord injury. As you age, part of it is nervous, part of it is the strength of this muscle itself, right? So we may see issues with the urogenital diaphragm that therefore cause issues with containing urine voluntarily. Okay. And that's because we do have natural sort of internal forces that cause us to want to urinate, right? So it's not just under conscious control. There are also involuntary parts. Okay, so the urethra in females is shorter than in males, 3 to 5 centimeters in length versus 18 to 20 in males. When we look at the external part of the urethra, the external urethral orifice, so just the opening on the outside, it's actually near the anterior wall of the vagina. So you'll look at that in lab, right? And in males, it's going to be at the exit to the penis, right? The penile urethra will have the external urethral orifice. So we actually name in males more parts of the urethra because it's long and it goes through different parts of the body because we have more organs there below the bladder that the urethra crosses through. So we have the prostatic urethra as we cross through the prostate. Then we have the membranous urethra. So that's a short portion that goes through the urogenital diaphragm. And then we have the spongy urethra that extends through the penis to the external orifice. So we have 3 parts in males. So we break that longer section of the urethra down, name what it's going through. So here we can just see the comparison of everything kind of together, right? So here we see our male over here. Here we see the female. Here we see the bladder and prostate in a male, just to demonstrate why that tube has to be longer, where it's going. Okay. And here we see some of those structures if we actually looked at them in section. So here is the prostate. Here are some other structures, the seminal glands that we'll talk about when we get to our reproductive unit. And here we see some peritoneal folds and the base of the bladder overall. So that's all we're looking at here. Finally, the micturation reflex. So that's peeing, that's urinating, and how we can control it. Okay, so when we're talking about the micturation reflex, we're talking about really the urge to urinate. And this happens at specific points when there's a specific amount of fluid in the bladder. So the first time you'll feel like you have to pee, the first urge to urinate is going to be when the bladder is filled to about 200 milliliters. And when the urine contents of the bladder gets larger than that, when we have more than 200 milliliters, that's when the internal urethral sphincter is going to open. So our internal urethral sphincter, right, it's opening at 200 milliliters, which means that now what we really have holding that urine in is our external urethral sphincter. So that's when you're voluntarily, on purpose, basically holding it, right? You're holding that external urethral sphincter closed. Now, some of that may be unconscious because you've trained yourself, right, as an infant and as a toddler. depending how bad you need to pee, how far you are over 200 milliliters, it may feel very voluntary, right? You may have to concentrate a little. Okay. So when you want to pee, when you allow yourself, you will open that external urethral sphincter, so relax that muscle, which will voluntarily expel the stored urine. And there is a point at which even that external urethral sphincter fails and you really can't hold it anymore. That usually is somewhere between 500 and 800 milliliters, right? So at that point, the pressure would be so great that it really will force the external urethral sphincter open. Okay. So some of the age-related problems we're going to see in the urinary system are going to affect the nephron itself, which the nephron, we looked a little at its anatomy, but as I said, we're going to talk a lot about the nephron. So affecting the nephron, we can see that nephrons are going to decrease in number. The glomerular filtration rate will decline, and we'll talk about what that is. But in simple terms, it's basically how much of your plasma is getting filtered through the kidney per minute. We'll see that we have reduced sensitivity to hormones like antidiuretic hormone, ADH. We'll see that ADH is partially controlling the kind of end part of our water reabsorption. And so if this is not well controlled because we don't have enough of this hormone, this results in more frequent urination. We can also see that we lose muscle tone, right, in that urethral sphincter because we're losing muscle tone into the urogenital diaphragm. So that can lead to incontinence. Also, if you don't pee enough, so if you have urinary retention, that can actually lead to infection. So that's a problem you may also see. Okay, so we're going to move on to the packet. This is titled, I believe on your end, Renal Physiology, so our second packet. We're gonna now start diving in deep into the nephron. So I'll give you a second to pull those up or pull those out. Okay. So we're talking about now is how we're going to have urinary excretion of solutes and water, how that's going to be affecting plasma volume, therefore blood pressure, right? Really, we're going to be focusing on mainly the renal exchange processes. So today we'll talk about filtration, secretion, and reabsorption. So these are words you want to get straight in your mind because we're going to be talking about how each of these happen in each section of the nephron, so each of the named parts. We're also going to learn some ways we can measure renal function. So we'll be looking at things like filtered load, glomerular filtration rate, clearance, transport maximums, and renal thresholds. All right, so we're going to have some numbers, everybody's favorite. We actually just talked a little bit about micturation, so that's on this list just as a reminder that you should take a look at that as you're studying. So now we're going to be talking about solutes and water and plasma, because that plasma and the contents of the plasma is really going to be important for what solute and water gets into the nephron, so what gets reabsorbed. Okay. So functions of the urinary system, we looked at the beginning of class, we looked at on Friday, right? We're regulating ion concentration in the plasma, regulating plasma volume, and thereby regulating blood volume and blood pressure. We also mentioned pH in class. We're also going to be regulating plasma osmolarity, right? So basically the pull that plasma is going to have on water. Right? And we can kind of think of how we would do that, right? By regulating the contents of the plasma, we're going to be regulating how much water versus dissolved proteins we have in there, right? We're going to be removing waste products and foreign substances. And we talked a bit about these on Friday as well, right? We're secreting some hormones like erythropoietin, which is controlling the development of our red blood cells, and renin, which we're going to talk about later as part of a big system having to do with water balance. We're activating vitamin D3 to calcitriol. So we're doing a little sort of calcium regulation here. And we can help the liver do gluconeogenesis, right? So making new glucose from other components of our blood, other nutrients we have, make new glucose to continue with metabolism, even if we're not eating a ton of sugar, right? Okay. So here we see a new but different picture of our nephron, right? So we can see some of the parts that I traced out for us at the beginning of class. So I'm going to trace those parts that we talked about first, and then we'll talk about this blood that's listed on here as well. So we talked about the renal corpuscle at the beginning here, right? So the renal corpuscle is composed of the glomerulus. So the glomerulus is actually basically a bunch of capillaries, right? Like a knot of capillaries in this structure called Bowman's capsule, which includes a space called Bowman's space. We'll take a close look at that in a second. We then go into our proximal convoluted tubule. Proximal because it's first, convoluted because it's twisty. We then go into our loop of Henle. So we're descending into the medulla, which you'll see is really salty, which is going to be important for some of the physiological function. And then we are going to our distal convoluted tubule, distal because it's later on, convoluted because it's twisty. And then we are going to go into our collecting duct. So that was the nephron part, but what we have labeled here on this slide is the blood flow. Okay, so I'm going to trace that as well for us. Okay. So we have blood flow coming in to our kidney. We're not going to worry about the specific name parts here. We're going to focus on the parts that are important to our nephron. So we're going to start out here with our afferent arteriole. So afferent, A always means we're going to something. So the afferent arteriole is leading to our nephron, specifically to our glomerulus. All right, so we're going to go afferent arteriole number 1, glomerulus, which is kind of a knot of capillaries, number 2. And then we're going to leave the glomerulus through the efferent arteriole. The efferent arteriole, we'll actually notice, is narrower than the afferent arteriole. And that's going to be important when we're talking about like the hydrostatic pressure in these capillaries and in the nephron, which we know is going to be important for Starling's forces, which we talked about way back when as basically how we figure out whether we're having filtration, how much filtration we're having, or whether we would be having absorption. Although spoiler, that's not what we're going to be seeing in the glomerulus. Okay, so efferent arteriole leaving the glomerulus. So we're going to say that's number 3. All right, and then we're going to see that it gives off capillaries. So these are our peritubular capillaries. So we have a capillary bed here surrounding our distal convoluted tubule. We can see it's connected to a capillary bed surrounding our proximal convoluted tubule. And we also have more blood vessels, kind of capillary bed here as well, right? Going around our loop of Henle, that nephron loop, right? So surrounding the whole nephron. So this part around the loop of Henle is called the vasa recta. And we'll talk about how the direction of flow in the vasa recta is going to be important to the function of the medulla as a whole and to the processes we see in our loop of Henle. Okay, so that's the blood flow around our nephron. So for the next little bit, so the rest of today and probably on Wednesday as well, we're going to be kind of stepping through the parts of the nephron. We're going to be focusing on sort of 3-4 processes that are going on. So we're going to trace where they're happening in each section and if they're happening in each section. So we want to be able to tell these words apart, right? We're going to be talking about filtration, reabsorption, secretion, and excretion. I think we actually kind of covered these terms like way back day 1 of A&P 1, something like that. And we've seen them throughout a little bit, but they're worth really focusing on now as we talk about the nephron. Because we're going to see all of these. They're not all going to happen at once. They're not all going to happen in the same place. Okay. So when we're talking about glomerular filtration, what we're talking about is plasma without its proteins getting filtered out of the bloodstream, so out of the glomerulus and into our nephron. So we're filtering into the nephron. So this is the filtrate. If I use the word filtrate, I'm talking about this fluid that has gone into the nephron and is eventually going to be urine. Reabsorption is going to be talking about moving things from the fluid in the tubule, so from the tubules, from that filtrate, back into the blood, and therefore back into the body. So when we say reabsorption, we're thinking about this like from the body's perspective, right? Things are getting filtered into the nephron, filtered out. Things are getting reabsorbed back into the body because they're going back into these peritubular capillaries, right? That's why it's important that the peritubular capillaries are there, that we have blood flow surrounding a whole nephron. Because if we didn't have blood, wouldn't really care so much what's going in and out of the nephron, right? Because where is it going to go? It's important that it's getting back into the bloodstream, back around to the whole body. So secretion is going to be the reverse of reabsorption. So secretion is going to be when we have things moving from the peritubular capillaries, from the blood, back into the nephron. So this is kind of like filtration, but we use a different term because we're talking about it later on in the nephron. Filtration is really going to be just our first step. Secretion we're going to talk about when we're making kind of adjustments later on in the nephron. And then finally, excretion is when we're actually exiting, right, the body. So this is going to be from the tubules out of the body. So when we talk about excretion, we're really talking about urine in the case of the kidney, or feces when we're talking about the GI tract. Okay. So filtration, reabsorption, secretion, and excretion are going to be very important to tell apart, because otherwise you're going to get really confused as we talk through this unit. So definitely make sure if you're a flashcards person, which I recommend being a flashcards person, right? Make sure you make cards for these. Okay. So here we see the direction of flow right at the beginning of our nephron, right? So here we see our blood flow coming in through the afferent arteriole, entering these specialized capillaries that we call the glomerulus, right? And we can see that there are lots of loops here. So we have lots of surface area for exchange. Then we're going out the efferent arteriole. So leaving the glomerulus, but we're not done with the nephron yet, because we make sure that we have a series of capillary beds surrounding the whole nephron. So after the efferent arteriole, we have peritubular capillaries, both around the proximal and distal convoluted tubules. We'll see the vasa recta alongside the loop of Henle. So that's our blood. And as we're tracing our filtrate, So we're going to see that we have almost all of our plasma in terms of like what parts of the plasma, right? So almost everything, just not proteins, is going to make it into the nephron. So filtration is happening. Then that filtrate is going to flow through the nephron. We're going to have adjustments to its contents. So we're going to see reabsorption. Specifically, right, we want to reabsorb a lot of the water. In this filtrate, we're going to have tons of water. We're filtering blood really quickly. We're filtering a lot of blood every minute. We do not want to lose as much water as we're filtering out when we're bulk filtering that plasma. So we're going to reabsorb things, especially water. We're also going to have secretion. So we will have certain things going into our tubular fluid later on. So specifically, we'll see a lot of sort of subtle shifts in ion concentration. So we're going to see secretion of lots of ions specifically later on going back into the tubular fluid as well. Okay. But as we talk about each section, we'll be talking specifically about what's getting filtered, what's getting reabsorbed and secreted. Okay. We'll start with the glomerulus because the glomerulus is the beginning. So the glomerulus, right, is a series of capillaries, right, basically. So we have these capillaries coming from the afferent arteriole, eventually leading into the efferent arteriole, right? So they're coming out like that. And they're surrounded by this structure that we call Bowman's capsule. So the capsule part, right, is this. So we have a capsule. It kind of folds in on itself, right? So we're going to see that there are epithelial cells basically lining the outside of the capillaries as well. And we'll see a space between. So we'll have Bowman's space, and that's labeled here in the bottom image, right? We zoomed in. So here we see Bowman's space. So these sort of three pieces together, the glomerulus, the Bowman's capsule, and this Bowman's space are going to form what is labeled on some of our previous slide as the renal corpuscle, right? Renal, because it's kidney, right? Corpuscle, which is hard to spell. Okay, well, that's what we're talking about when we're talking about the renal corpuscle. Okay, so what's happening at the glomerulus is filtration, right? So we're going to have bulk filtration. We're going to be basically filtering the full contents of the plasma except for proteins. So we're going to have lots and lots of fluid with ions, with waste, filtering from the glomerulus into Bowman's capsule, into this Bowman's space. Now, the usual glomerular filtration rate, or GFR, is 125 milliliters per minute, which is 180 liters per day. That is a lot more fluid than you have in your blood, which is why we emphasize so much that reabsorption is really important. You cannot lose 180 liters of fluid a day. I mean, you couldn't. So the glomerular filtrate is filtering really fast. It's going to cross 3 barriers as it's entering Bowman's capsule. So when I say barriers, I basically mean cell layers or membranes. Okay. So the 3 layers it's going to be crossing are basically part of these fenestrated capillaries. Okay. So we are going to see, yeah, they're labeled down here. So here we're inside the lumen of the capillary. So this is like where we'd have our red blood cells, right? Red blood cells are also not going into the filtrate, by the way. That counts with the proteins, right? Hemoglobin stuff. Okay. So here's where we'd have our blood flow. Like every capillary, we know that it has a cell layer that makes up the capillary walls. So we have our capillary endothelial cells, right? So we have 3 barriers, right? So one of those is the capillary endothelial cells. Then we have this basement membrane. The basement membrane is sandwiched between the capillary endothelial cells and another layer of cells are epithelial cells, specifically in this case called podocytes. Okay, so here we have those podocytes, they're epithelial cells down here. So that would be number 3. The basement membrane is a membrane sandwiched between them. Okay, so when we are trying to get filtrate, so contents of the plasma into Bowman's space, we're going to have to go through the capillary endothelial cell, through the basement membrane, through the podocytes. Because these are fenestrated capillaries, we do make this pretty easy, right? So these podocytes are weird looking, right? So they have these long processes, and they have these foot processes or pedicles that branch off of them. They have these filtration slits between the podocytes. All right, so we have these big gaps where it's even easier to get through and get fluid, these contents into this Bowman's space, right? So we have 3 layers, but it's pretty easy to get across. We're just not having anything super big like our proteins or our red blood cells getting into the nephron. Here we see zoomed in even more what this would look like. Okay, so here we actually see histological stuff. All right, so here we see the foot processes. All right, so those pedicles of the podocytes. Here we see those slit pores. Right, so these sort of spaces between. And here we see our capillary endothelial cells, which have our little windows, our fenestrations. Okay. So that's the filtration barrier for things crossing from the plasma and becoming filtrate. Okay, so as we leave, I want to do a quick poll. Make sure we know and hopefully we'll remember when we meet on Wednesday what we're talking about when we are talking about filtration. Okay. Most people are getting this right, but we do have a somewhat substantial portion of people who are still confused here. So just want you to make sure that leaving today, you know that filtration is movement of this protein plasma out of the blood and into the nephron. So filtration is this first step of fluid coming out of the glomerulus and into the nephron. Okay, so we'll pick up here on Wednesday. Have a great day, and remember you do have lab tomorrow. I know it's been a while. There is lab. Take care.